So Sectra is pretty much involved within the imaging and the management of images, be those images from a traditional radiology environment, which we all know and understand, or pathology images. Digital pathology is a huge next wave of digitization within the NHS, and it's already started in Scandinavia and in the Netherlands. The NHS is now primed to really take on that next step for digitization, and that's the pathology area, that's within pathology. Huge data sets, huge opportunity to share resources, to workload balance across the region.
Sectra's approach is about ensuring that radiology imaging can be seen alongside photographic imaging as well as pathology imaging. This means that the diagnosis can be that much more effective and that much more efficient. All radiology, pathology and gross visible light imaging can be reviewed at the same time within a setting where multiple professionals are able to discuss and therefore collaborate on the diagnosis. We believe that this will increase the specificity of the diagnosis and improve the outcomes for patients.
So they're areas where Sectra is very much involved in, not just delivering the technologies to be able to enable the management and distribution and reporting of images, but also to be able to assist in the regional and scalable solutions, to allow workload to be balanced across a region or a nation, for example, so that we're sharing information, we're open, we've got open interfaces to other technologies and other solutions to be able to deliver a more enterprise-wide or region-wide solutions to our customers, really. And I guess we're driven by, we have to understand the customer's strategy. When we can begin to understand the customer's strategy and understand what they're trying to achieve, it's almost no limit to what we can support them in doing. We're one part of the puzzle. There are elements upstream and downstream, but we need to have a vision of where the customer's going in order to be able to help co-develop or partner with them to deliver the sort of solutions that they're going to need in the future. Well, we recently produced a paper and it was really touching on the issues around big data and the potential for big data and the NHS in the near future. The archive has always been a kind of a necessary evil within solutions such as PACS solutions and VNA solutions, but really the potential is a goldmine for the NHS. And we need to find a way of structuring that data so we've got the opportunity to interrogate that in the future for the benefits of patients, for the benefits of populations and driving improvements in healthcare.
So Sectra's approach to the delivery of diagnostics is integrated diagnostics, and this means that all information is available within a single system. This increases efficiency for the clinicians and indeed for the patient. Think about the MDT. In an MDT setting, there's a lot of clinicians from a lot of different disciplines. Having all of the information available within a single system ensures that the diagnostic process can be discussed without the barriers traditionally put in place by older technologies.